So just act. You'll figure things out as you go along and just start working at it little by little. And that's why things take time. But if you sit there waiting to consume all the knowledge around the thing that you want to do, you're going to be sitting there wasting years where you could have just been in motion already. So don't think you're going to figure it out at the beginning. Just get started and get moving.
Dr. John Chuback here. Welcome to the Business of Better podcast, where we talk about all things entrepreneurial as it relates to medicine and healthcare. And today I have a very, very special guest with me, Dr. Jose Almeida, who I've known for, I would say, roughly 20 years now. And it's a special moment for me, a special day to have Jose on the program, because he's one of my personal heroes, quite frankly. And I'm going to tell you a little bit why. Jose and I have similar backgrounds. We're both surgeons trained here in the United States, and Jose's a vascular surgeon by training, trained down at the University of Miami, and he could tell a little bit about himself. And I'm a cardiovascular surgeon trained up at the University of Rochester and Strong Memorial. And I think we both saw some similar things happening in medicine many years ago that kind of shocked us and made us aware that maybe we needed to take a new path. And we both got involved in vein care a long time ago. And I had the good fortune of finding out about Jose's Vein Congress, International Vein Congress down in Miami. And I attended that when it was in its fledgling state and watched it grow to amazing heights over the years. But what I wanted to share with Jose, that he may or may not know, probably doesn't know this, is how inspiring he was to me. I think he's just a few years older than me. But when I saw what he did with International Vein Congress, I was really, really super impressed. The Congress was international and shared a tremendous amount of information for surgeons at that time and all kinds of doctors since. But when I saw the lifestyle that he was living in Miami Beach, and I was in New Jersey, and the weather and how he was taking such great care of himself physically, etc., I was really impressed. And to the extent that I said to myself, there's a better way to live, there's a better way of doing things. And my wife and I both recommended to our sons that they get their life started down in South Florida. They both went to law school there. They live there, one in Naples and one in Miami. They're in business now, not practicing law, but they're in business. And Jose also inspired me to do some of the entrepreneurial things that I did and have the courage to start Vitasport MD and create the supplements and all of that. So with that, I want to say a very warm and special thank you to Jose Almeida and welcome him today to the Business of Better podcast.
Well, thanks. Yeah, delighted to be here. I didn't know all that, John, but it's interesting as I look back. I don't think this is the path that I saw for myself, or probably you feel the same when we got into doing big cases. So Miami's an anomaly. What happened to me, I finished my fellowship and I came back to Miami. In Miami, there were no vascular surgery groups. And I can go into that as to why, if you want to, is from our chairman of surgery didn't believe, our surgeons needed vascular fellowships. So that left a void in Miami. So there were general surgery groups that did vascular. And I finished my fellowship. I joined a general surgery group. I don't think I lasted 6 months. I didn't want to do general surgery. So I went solo. So I'm as things start out, I'm the kid. You got to pick up the scraps. Nobody's going to give you any cases. So, 8 hospitals I'm covering, getting work out of the emergency rooms just to, feed the wife and 4 kids. And back then, 30% of what came to the emergency room were indigent patients, uninsured. And as you know, these are the sickest people that come in. They don't come in tuned up. They're sick as hell. So I found myself doing these big cases, taking all this liability for crappy reimbursement, none. Yes, I got my cases here and there, but that's kind of how I started. So I found myself solo on 24/7, 365, covering 8 hospitals. And Miami traffic, I'm in the car 3 hours a day going hospital to hospital. And then I just start, what are you doing, man? I love the surgery. And then the way I tell people, when I put the loops on and got in the OR, I'm in frickin' heaven. But when I took the loops off and took out of the OR, then all the calls and the nurses, I didn't have residents taking, front line, 2 in the morning. So the things that would upset me were not going in to fix a real problem. That's why we went into this. It's when I get called to a hospital 45 minutes away at 2 in the morning for a cold leg, and I go down there and they have normal pulses. I wanted to kill somebody. And that just kept happening over and over. And then I just, what am I doing here? So at about 5 years, I was fried. I was cooked. And how do I figure this out? So what's the key to happiness here is get out of the damn emergency room. And then it turns out a little brochure came around my desk around 1999 called In-Office Vein Surgery by a surgeon named Ron Bush. I went to his little seminar in Orlando and learned about the magic of tumescent anesthesia. Started doing vein stripping in the office. That's before the new devices. And then, started getting that going, weaning off the hospitals. And then when radiofrequency ablation got approved in 99, I got one in my hands at around 2000, 2001. I did one case, no randomized, one case. I said, this is it. I'm done. This is me. And then I started all in. I'm in with the vein practice. Let me see how I get out of the hospitals. And yeah, you know, look, we got one life here, man. This is not a dress rehearsal.
Yeah.
I started forward thinking 20 years from now, is this what I want to be? Like my vascular surgery buddies, old and hunched over and fried, and or do I have a chance to, get some balance? And I don't know if you remember the early IBCs, but this introduction that I always would do is about balance. And yeah, it showed the family and how I was missing out and how I try to get my life back. And that's what did it for me is an in-office vein practice, no emergencies. Um, so that's my story, and I'm sticking to it. Now, my wife will tell
I
you
would.
something else because now I get into veins, deep in all veins, and then I've got into bodybuilding, and then I'm in the gym every night, cranking that. I needed to feel hardcore now that I'm not doing aortic aneurysms, and that led to a whole different set of problems.
Yeah.
uh, but uh, but yeah, no, I mean, looking back, I'm very fortunate, have a great life. But that's the other thing. I was headed for divorce. I was angry. I was one of these asshole vascular surgeons. I was just getting angry. So
Yeah. I
I
know that.
married the same one for 32 years and 4 kids, all grown up, got them through college. They're all doing great. So I've been very fortunate and blessed. I have no regrets.
Yeah, that's amazing. We have so much in common, so much in common. Uh, the amazing thing, and I think it's one of the take homes for this program, is how some of us who I think are really driven individuals, we spend our whole life preparing for something that in many ways can be very unpredictable. So I had every intention of doing open heart surgery my whole life. I did it about 6 years, just open heart. And with the way things changed, it was clear that that wasn't going to be, for me personally,
Yeah.
the best circumstance unless I wanted to take a job with a big system, which wasn't really in my DNA, wasn't my personality to work for somebody. And again, I remember getting a postcard about this big on my desk in the hospital. In those days, my office was in the hospital, though we were in private practice when I was doing cardiac surgery. And it was from Dornier, uh, laser company had Ron Bush giving a 45-minute lecture in Manhattan. And I called my secretary and I said, Christina, put me on for this. I want to go check out what this is about because our volume was way down, our reimbursement was way down. And I went and I heard Ron talk and it blew my mind. It just blew
Yeah,
my mind. And then I went out to Dayton and I spent a day with him, which was, it was funny because in those days, Jose, when we were doing the big case, I remember on the phone in Dayton, I was back and forth with the hospital 10 times about a mitral valve I was doing the next day. And I'm watching this guy, how he's living and going out to lunch. And, he's got this low stress lifestyle and
yeah,
cranking out cases and making great money. And, and I just watched him for a day and I said, oh, yeah, I know I could go home and do this. This is not a problem. I didn't need,
right.
extensive training and so forth. Not to say I didn't learn a lot over the years, but I just added it to the practice immediately. But it's so funny how Ron had that impact on you and me. Ron hopefully is going to be a guest here on the Business of Better podcast. But so we've just got so much in common. One of the first questions I want to ask you is about your first, from what I understand, to be your first entrepreneurial endeavor. And I think that would be the International Vein Congress. So after switching gears like that and getting into the veins and being as successful as you were down in Miami, what was it that inspired you to put together that Congress and tell us the story. How did you make that happen? That's a big deal.
Well, it's funny because I don't look at it as a as a business. It was never about the money. So the way that developed during when I was doing vascular surgery. Part of what I did was with the Miami Cardiac and Vascular Institute. So Barry Katzen's a well-known interventional radiologist down here, and they became more influential in vascular than the vascular surgeons for what I explained. There were no vascular surgery groups down here. Robert Zeppa, my general surgery chairman, and that's why I came to Miami because of Zeppa and the cocaine cartels were flooding the streets with gunshot wounds. That's what I wanted. That's to me was surgical training. But Zeppa's mantra was my boys don't need vascular fellowship. So there was a void in Miami in vascular. And Barry Katzen, a very clever, skillful, I love the guy, interventional radiologist, set up this institute, and he's the one that got stent grafting, one of the early pioneers in aortic stent grafting. So a group of us vascular surgeons would support those cases. Now, they would do the cases and we were really support, there were a lot of conversions that needed to be done then on the table that, felt like a cut down boy really at some times. But they had this meeting called ISET and they would do live cases. And part of, as me being part of the MCVI team, I was part of ISET early on and still am. I've been speaking there for 25 years, but I would scrub on the live cases. And I thought that was, a super interesting way to do a meeting. And then this vein thing came about and I said, you know what? Uh, let's kind of do the same thing. We'll do live case and teach vein. This is a developing industry. There's a bunch of new companies around this. The the complete conference management run by a woman named Susan Holtzman. They were the managers for ISET. So I went to Susan. Hey, I'm looking at this. I'm pretty much going to do all veins here in the future. I'd like to start a meeting. Can you help me? And she did, and that's how we got it going. Uh, one of so that was like the model. The live cases is really, I thought that was such a good teaching model. That's what set it for me. But uh, one day in the office, um, patient asked me, I was doing these new vein cases with the laser, and she asked me, "So why are you the only one doing this stuff?" I'm thinking here I'm some cutting edge dude, the only one doing this in Miami, minimally invasive veins with endovenous laser. And then it struck me that, you know what, I'm hanging myself out on a limb here. This is not standard of care. And then I presented a couple local meetings, South Florida Vascular, and these surgeons were throwing darts at me. Are you out of your mind doing vein stripping in the office? So, let's get a meeting going. Let's get this out there. And then I found some like-minded individuals. Ed Mackey in St. Pete was doing this, Ron Bush, Lowell Kabnick. There were a few of us back then. The meeting started in '03, so I started getting this organized around '01. And I don't think there were a dozen of us doing this in the country. And got these folks together, called the industry folks. The first meeting was a million calls and emails. I'm so and so. I want to do this. This is what I'm looking at. Blah 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 blah. So we got some industry people. We got a faculty. I didn't know if anyone was going to show up, and the first one was in September of '03. Interestingly, they'll never do September again because a week before the meeting, Hurricane Isabel is heading right at us. That's hurricane peak season. Thankfully, it turned the Monday before the meeting to go north. I was shitting my pants after all this work that I was going to have to cancel this thing. So, needless to say, never another meeting in September. But the meeting filled up. So, I said, you know what? Let's hit this thing. Let's do it again. We did one 6 months later. That was at the Sonesta Hotel in Key Biscayne. We had to get out of there. We needed a bigger space. We went to the Intercontinental, more in downtown. That one got, oversubscribed in about 4 years. We went to the Fountain Blue. That's when it was at its peak. It was huge. And then that just got too expensive. And then we settled in the Lowe's. So it's been the Lowe's Hotel the last 12 years. But, it was never about money. There's some years where, I paid myself a decent honorarium. Other years where I had to pay out of pocket. After COVID, I got hit out of pocket. So it was really about, starting a meeting and, yes, that would help me get my name out there, get the space, developed, learn the industry people, and certainly met a lot of great people over the years, and gotten a great faculty. You were part of it last year, and, it's been a lot of fun. But I never saw it as a business opportunity, nor do I now. I just saw it as start a meeting around this space that doesn't really exist. Let's make a space.
Yeah, that's great intel. That's great information. And I think a lot of people who know you might have a misconception about that. Now let's because this is the Business of Better podcast, and you and I have talked quite a bit about the business of medicine and the pitfalls and the pluses and the minuses and so forth. How about some of the other projects that you've done? I'm aware that over the years you did a training program in, I believe, in the Dominican Republic for surgeons and so forth. Was
Eh,
that something you considered entrepreneurial or
Yeah,
management?
so the way that started, that was in the Dominican Republic. A friend of mine named Julian Javier, who's an interventional cardiologist, is Dominican, and he came to the office one day to wanted to learn about veins. And we got to talking, let's do a hands-on course. And down there, he had a friend with a clinic. We could get lots of patients that are underserved and bring some American docs and train them hands-on. And we did two a year for a few years. Um, and that led into something else that was a business that I'll talk about in a second. But what the reason we stopped doing the course was these what I didn't feel were the right type of doctors coming down to learn this. I really set it up for trained surgeons or trained interventionalists. And when an ophthalmologist showed up to learn about veins, oh no, man. So I don't think I'm doing a service here. I'm now that weekend course that people talk about. Go and do a weekend course and start doing veins in your office.
I hear what you're saying. I think guys like you and I are aware that for years, I think that's what was being done, let's say, with cosmetic, quote unquote, cosmetic surgery,
Yeah,
where people who had no business doing any kind of surgery whatsoever would be going for that weekend course and then
yeah,
doing some really poor work when they got back because they just didn't have the background. So I
right.
could certainly see how you would feel that way if those were the sorts of people who were starting to sign up.
Yeah, yeah. And I was kind of I don't know what the right word is, but kind of, bullheaded through all this. I'm a vascular surgeon, vascular surgery brand. I thought this was a procedure for surgeons. As you know, it's not a difficult procedure. Learning the patients, I think, is, requires some knowledge, but, the actual procedures aren't, a lot of skill. But as you know, the space has developed into something else now. The last I looked on a Medicare fee schedule, 42 specialties build Medicare for vein procedures, including, radiation oncologists, psychiatrists. I think the only specialty I didn't see were the veterinarians. We're just waiting for them. So, I found that a little disappointing that, this, uh, I think that's a financial move for people, not really that there's, an ENT doc suddenly is now interested about vein disease. Now, having said all that, we're all dealing with the same cuts in reimbursement, primary care as well as us. And now that we're getting cut, I see things differently. Now we've got, a whole Medi-Spa in our office. I'm not a trained plastic surgeon, dermatologist. What's a vascular surgeon doing with a Medi-Spa? Well, we're getting the hit now in reimbursement that I didn't really see. So, our primary care colleagues, they're cranking out 60 patients a day, 5 minutes each, getting paid, crap, and they're grinding it. And it's just basically the healthcare system for doctors is not as friendly as it was. So, things are, so I mean, I understand now why people venture out of the scope of practice. I guess what I'm trying to say is I'm looking at a certificate on my wall there about the oath from the American College of Surgeons when you get your FACS and become a fellow. One of them is don't step out of your scope of practice. So I felt that to do surgical procedures, you needed to be a surgeon. And, things are different now.
Absolutely. Well, yeah, you were kind enough to invite me down to the International Vein Congress this year and speak. One of the subjects I spoke about was entrepreneurship in medicine and really entrepreneurship for doctors. And as you know from my talk, it was broken basically into two areas. One would be venturing out into fertile areas inside of medicine, and one was outside of medicine. So we've touched on a couple of things that you've done, IVC, and then the training down in the DR. And then you started to mention that there is
Y-
something entrepreneurial, at
Yeah,
least.
so
So what can you share?
so in the Dominican Republic, working in the clinics, we found that I mean, it was incredible. And so the first time I went down with Julian Javier, we met his friend, Dr. Juan Canella, who's an OBGYN. His father started the clinic down there. It's like a miniature hospital down in La Romana, Dominican Republic. And I went down to, Julian and I went down to meet Dr. Canella and listen, uh, I'm going to bring these doctors down. There need to be patients here. I'm going to have egg on my face. Are there going to be patients here? We got there the first time. They were around the building, 80, 100. We start screening them for the first course. These people are coming in. We start, in our normal American way, doing a formal history and physical. Julian and I tag teaming. I had an ultrasound probe in my hand. We're documenting. And Dr. Canella walks in and, what are you doing? And what do you mean, what are we doing? You don't need to do any of that. So we just talked to the patients, no documentation, got them set up to come in on this date. We screened who had a saphenous vein or something beta, and these people just showed up. They're indigent patients with no care down there. So we're providing good care. We're cutting edge stuff and training our doctor buddies. We were there supervising them. So that was a hands-on course. So we learned there is a huge volume of underserved patients down here. We started getting approached by industry on clinical trials, new devices. So I talked to the industry, and you know what? We've got this place down there. We can do 30 cases in a weekend with your new device, first in man studies. Think of it as go, no go. We'll do these cases, see if your device works. Obviously, this was vetted already through bench work and animal work. They're safe. Okay, that's already safe, but they needed first in, now they call it first in human. Uh, so we did a few of these, and as advertised, we did 30 cases in a weekend for a few of these vendors. Some of the devices were great. They went on. Some we told them this is not going to work. They quit investing. They loved us. This went on for about 10 years. It got very formal. We actually got into peripheral arterial and cardiac cases, trials at a hospital, more formal. Our protocols had to go through this national ethics committee. And again, for years, we submit, these are, well designed. We're working with American companies. These are protocols that, they got to come back and get FDA approval. So this was serious documentation and stuff for the trials, unlike the courses. But we could do a high volume of patients in a short amount of time. And then we started submitting our protocols to the National Ethics Committee in the Dominican Republic, and they started blocking them all of a sudden after we must have done 30 of these already in 8 years. And what's going on here? And, we're making promises to company. No, this is a guarantee, we'll get you in, we'll get you squared away. And one got blocked. So Julian started going to the National Ethics Committee. What's going on here? And I don't know what's going on, but I didn't want to be a part of it. Let's just say I think they were asking for money under the table now, and I was not going to be a part of that, so that kind of stopped. But that was a business opportunity where we could help patients with modern devices. We could help our industry people learn things quickly. We got a bunch of academic papers out of there and published, made some money. So that was, all good until it wasn't. But that what really turned into a business. And the shame of it is we were about to scale this thing. And then this National Ethics Committee threw a big wrench in the soup. Uh, but I didn't want to pursue the path that they were laying out for us at that point. So,
Understood. It makes sense. Are you involved in anything outside of medicine right now in terms of entrepreneurship?
well, I can tell you about a project that didn't go so well. I started a gym. As you know, I was heavy into bodybuilding and competing, and the gym that I was working out at was folding, and I saw an opportunity, and I bought it with the my trainer that I worked out with, and then COVID hit, and I want to get out of we had a 5-year lease for the gym, and I got tired of paying rent, so I bought a building, and then after I'd rushed to get in this building because I had to get out of the lease, and this is a story of why not to hurry things. I buy this building, and the previous certificate of use was for retail. It was on North Miami Avenue, great location. That's why I jumped on it. I was all focused on the location. And after about a year, we did some, things to get in there real quick without permits, just knocking down some drywall and putting up a gym, moving all the equipment over. It's not a big deal. But we couldn't get the certificate of use because the city of Miami wanted us to put an elevator in the building and make all the bathrooms, ADA compliant. And I did not see that one coming. Put a elevator in. Um, so we ended up not pursuing that. So this whole gym thing was 7 years. I put in a lot of my own money and lost on the gym. Now we got the building rented, and it's a good building. It'll do okay, but that didn't quite work out as I wanted. I wanted to make that into a medical gym. So we had the weights, we had the trainers. I was bringing in some new medical equipment, kind of functional equipment. We've highlighted that at the IVC meeting, a couple of these devices, Emsculpt Neo, that can help you burn muscle and lose fat, some skin devices. We have a DEXA scanner. So I kind of want to put this medical gym together where, we teach you how to eat, we teach you how to train. And if hardcore workouts aren't your thing, we got some supplements, either machines or supplements that can help you do this. But when the city of Miami told me I'd invest to put an elevator in the damn place, that sort of started falling apart. So that's a business venture that did not work out the way, I saw.
Yeah, well, I appreciate you sharing that. That's all really, really valuable information, and I think it's one of the things that we talk about here on this podcast, and I talk about, quite candidly whenever I have an opportunity to speak, that nobody bats 1,000.
Yeah.
They can't all be winners, and like they say in baseball, if you bat 300, you go to the Hall of Fame.
Yeah.
So it's not always easy, and sometimes sometimes you hit it just right, and sometimes you don't.
You just
But
got to learn and move on. Yeah.
yeah, and to be dynamic. I mean, the other the other message in what you've done there is it sounds like that's going to work out for you, having a great
A
property and a
rental
great
property.
location.
Yeah. Investment property.
But you had
Yeah.
to pivot,
Yeah.
and look, there's no bigger pivot than what you and I have done with our very, very formal, extensive, difficult, lengthy, um, challenging surgical training, and then getting out into an environment where it wasn't maybe what we anticipated, and we were both able to pivot into a new space and reinvent ourselves. So I think that for people who are interested in entrepreneurship and business in general, um, they have to know that it's a challenge. What advice do you have for docs and other healthcare providers who are thinking about taking that leap outside of, because that's a project you did outside of medicine, although you were going to involve some aspects. What advice would you give them?
That's a tough question because, I mean, I think it has to be a genuine interest that you're pursuing. Um, the old adage, just work on getting good at it and the money will come. But if you're going for a shortcut just for the money, that usually doesn't work out in my experience. So, I mean, the gym thing, of course, the competitive bodybuilder for 20 years, it was in my wheelhouse. I thought it was a slam dunk that we're going to do this thing. In my mind, this medical gym was going to explode. I was going to. I'll tell you another story too, and we'd scale it and do a couple of them. Here's another one. Around 2014, the one of the high level sales rep for Venous Medical, VNUS, the original RF device, uh, and I became friends. And years later, we wanted to do a roll up of endovascular centers of office space. They're calling them OBLs now. Office space labs, both venous and arterial. And I was on the phone, around the country with my buddies who are interested in starting this thing. And then his name's Scott, our business guy, was out there, raising funds, finding investors. He was well versed in this. He'd already done, got into a CEO position of several companies and exited for good profit. He was an expert in this. He was like 5 for 5, and approached me if I want to do a roll up of endovascular centers, and we put all this work in for a year and a half. He found an investor that wanted to put in $30 million, and then the new Medicare fee schedule came out. This was back in 2014. We had this thing ready to go, and the investors saw the new Medicare fee schedule and the upcoming cuts, and they pulled it. After about a year and a half of a ton of energy in this thing. So that one didn't work out either. And we thought that would have been a, great opportunity. Um, so, batting 300, I may be batting less than 300. I don't think I'm going to the Hall of Fame in business.
You're still an
And
all-star.
my wife will tell you I'm the worst businessman that ever walked the planet.
Well,
She's
well,
our business person. My wife is the one that really knows how to run the spreadsheets and see, and she's our business person in our family, not me.
yeah, same here. And I've got that. I've got that with Diane in my practice, and Maria, who's been with me 20 years, who's in the practice, and then some of the other entrepreneurial things that we do. But one of the things that you touched on that I'll chime in on for our listeners is that I always say surgical training in some ways is a great um, background to have if you want to get involved in this kind of thing, because you're certainly not used to uh, get get rich quick schemes. If
Yeah,
you want to become a surgeon, you've got to go through 4 years of college and 4 years of medical school and 5 years of general surgery and a couple of years of advanced training and so forth for what we did.
yeah,
And that's the shortcut. I mean, Jose
right,
and I both know plenty of guys who had to get master's degrees first before they get into med school and then
yeah,
do years in the lab in order to finish surgical training. And
yeah,
it can be a really long haul. So I think that's helpful for folks like us, that we don't expect, although it would be nice, you always can dream and fantasize, but we don't expect to hit home runs overnight. But even with Vitasupport MD, where it has been a successful project and has worked out well, but it's almost 11 years. And my partners and I, it was almost 9 years before anybody ever got paid. Um, the
yeah,
company was successful and profitable almost out of the gate, but because we didn't have a big outside money person or
yeah,
group investing, everything that we made got reinvested back into the company to grow it little by little, slowly. So I think that's one of the good take homes is whether something takes off or it doesn't. I've never had an overnight one. I've never had one of those grand slams. I've never had the
yeah.
thing I bought and the next day it's work and it's dedication and it is perseverance. And I always joke, you reminded me of something, Jose. If ever like my financial advisor calls me and makes a prediction, if I'm going to buy a stock, I usually call all my close friends and I tell them if they have it, they should sell it. Because once I buy it, I
Yeah,
can
it's
assure you
going down.
it's
Yeah,
gonna tank.
yeah,
It's a race for the
yeah,
bottom after JC puts his money in. So
yeah,
somehow it feels that way,
yeah.
but I know.
I think the quick home runs are not the norm for most people. During your talk at IBC this year, which was great and very inspirational, I heard some stuff, some Napoleon Hill in there, and a lot of the work that I read, which is the famous book Think and Grow Rich. It's not about think and growing rich in money. It's think about growing rich in your life. How you really a thought has to turn into an emotion. You have to internalize it. The conscious thinking has to get into the subconscious, and it's a process. And then you got, it sounds kind of wacky, but you get it into the quantum space of the universe. Call it divine thinking, call it God, but you got to be in the rhythm. You got to be aligned. Things got to be flowing. You got to be ready to just work and grind. And we're made to struggle. Struggling is the only way to grow is through struggle, at least that I know of. And that's a tool that's been given to us from whoever, designed this thing called life. But it seems that if you don't struggle, you don't grow. So the struggle is part of, uh, getting to the next step. And a lot of people give up right when they're on the cusp instead of just pushing through.
Yeah,
Uh,
and
but
certainly as a bodybuilder, you understand that in a very tangible way.
Yeah, and surgery. So I think, for most people and most companies that have done well, it's just been through, persistent grind and staying with it. It usually needs to be a genuine interest, but it's not going to be, a quick lotto ticket for most people. You get an idea, to get let's just go back to medical. When what we learned with these devices, we also built and sold a couple devices as part of the device company that we had. So you learn real quick that to get an idea on a napkin to a product on the shelf, that's not easy either.
Well,
So
I
if
don't
you
want
go, 5, 10K pathway with a predicate device out there, you're probably looking at 5 years and a couple $1 million. But if it's a original and you got to go through a pre-market, PMA pathway, you got to rate that can be 10, 20 years and $100 million to get there. So it's a big investment of time and energy and capital, and that's why even though some of us, look at big pharma as the evil and these big industry device makers as raking it in, They had to go through the process, and if there's not a CPT code on the end of that getting with showing reimbursement, nobody's going to invest, and innovation doesn't get done. But the point is to get an idea to a product on the shelf. It's not a quick little magical thing that you get lucky. No, you got to grind it out, and you may or may not get there.
You mentioned, and you and I have been on this path of personal development. As you know, I've written a few books myself over the years, one of which is called Make Your Own Damn Cheese. It was a response, sort of a sequel to Who Moved My Cheese by Spencer Johnson, which
Yeah.
really helped me to change my life when I was in cardiac surgery and I had seen that the playing field had changed. And that's what happens sometimes. Maybe it's the governmental body in the Dominican Republic changes their attitude towards something, and then suddenly, the spigot gets turned off, or suddenly you're on this track to be a cardiac surgeon and have a great career and do tons of cases and help people. And then angioplasty and stenting change the playing field. There are things that we can't predict, and we have to be dynamic and willing to change. And so I've done a lot of that study. Would you share with our listeners, our viewers, maybe two or three of the top books that you would suggest on this subject?
Oh, wow. So, I'm not much of a, especially nowadays, I'm not much of a reader. I'm more, I like podcast and video. I like
Perfect.
consuming content, on the treadmill or in my car. So, me sitting and reading a book per se, but I don't know. In general, it's things like, or content that attracts me is, stuff like Napoleon Hill, who and it's basically just what we just got finished discussing. Um, how to you know develop an idea. Things start with idea. How to internalize it and how to act on it, and how to you gotta decide. You can't. Procrastination is you never gonna get anywhere. So you learn these tools of if you got something, you got to decide quick and act. Nothing's ever ready, so you'll never be fully prepared. People get into this trap that well, okay, let's just take something. Uh, I want to do a new innovative procedure with anything. Well, I'm not quite trained enough. I think I need, a couple more courses before is the plate is never like set. So just act. You'll figure things out as you go along and just start working at it little by little. And that's why things take time. But if you sit there waiting to consume all the knowledge around the thing that you want to do, you're going to be sitting there wasting years where you could have just been in motion already. Because as you stated, things are never quite the way you plan. What's the old adage? How do you make God laugh? Make a plan. So just get going because it's not the end point is not going to be what you thought it was when you started.
Yeah.
So
I,
don't think you're going to figure it out at the beginning. Just get started and get moving.
yeah, in my other book called The Straight A Handbook, where I share 50 of my top lessons from being a student all those years. I talked to a friend of mine, Tom Potenza, who was a very wealthy businessman, was a very successful guy. He's a great guy. And I said, Tom, why do you think you were so successful where others in your field, he was in programming, computer programming, were not? And he said, "Well, let me ask you this question. It's a riddle." He said, three frogs are sitting on a log that's floating in a pond, and one decides to jump in. How many frogs are left on the log?" So I said, "Well, it's a riddle, but I'll bite. There's two frogs left." He says, "No, there's three frogs left because deciding to jump in and jumping in are two totally different things." And he said, "I was that frog that just kept jumping in all the time, not
Yeah.
not knowing exactly what was going to be in the water. Is there an alligator? Is there a snake? Is
Right.
there, do I even know how to swim?"
Yeah.
So, as you said, you have to make a decision and then you have to take action and then you have to go. It's like, again, I think it's one of the strengths of surgeons. you get called in to do a big case, you can have a plan in mind, but God knows as surgeons, we know that that plan doesn't always unfold the way that we hope for, and you have to have lots of contingency plans in place.
I just this morning was at the hospital, went in there to take out a vena cava filter, chip shot,
Plan was to take out the filter.
be in there a few minutes, uh, go down the neck. This patient had a thoracoabdominal aortic aneurysm and torched the whole vena cava into a curve.
Right.
So I go down with conventional devices and sheaths and a snare, and the filter's here and the snare's over here, just because of the tortuosity of the vena cava. Try a few sheaths up and down. I'm sitting there, what the hell is going on here? And finally, I didn't plan this, get the bronchial forceps and get that through a well-supported sheath. And then next thing I had to I torqued this bronchial forceps into a bow like that to get this thing to curve, to get on the filter, and we got it out. But I didn't, I
You weren't
was
anticipating
going
that.
in to take a little filter out.
Oh my
And
goodness. Well,
here, again, how do you make God laugh? Make a plan.
make a plan, right? Well, as we come close to the end of our time here, I've got a couple questions left for you. The first would be, I hate to catch you off guard. You could take a minute to think, but if there were one person, dead or alive, that you could sit down and have dinner with and pick their brain, who do you think that might be?
Um, I'm gonna go with I got asked a question at IBC by Steve Elias one day, and he goes, "Who would you rather sit down with, uh, Arnold Schwarzenegger or Michael DeBakey?" And I said Arnold Schwarzenegger for sure. He was one of my childhood heroes, he just turned out to be such an interesting, career from bodybuilding to acting to governor of California, and still going at it. Uh, so, I mean, he'd be a person I'd be really curious to sit down and talk to. I mean, I remember as a kid looking at him, he's like the guy that turned bodybuilding around, and, almost if it wasn't I grew up my father's a physician and my mother said you can do whatever you want, but you're going to be a doctor type of thing. If it wasn't for that, I probably would have, gone into sports and bodybuilding. I don't know.
Yeah.
But yeah,
And he had a very humble background in
yeah,
Austria, a long way
yeah,
from where he wound up in the sunshine of
yeah,
California. I could I could see that being a very interesting conversation on a lot of levels.
yeah.
And the last one I would ask you, in terms of conversations with other people, if you could sit down and talk to the 20-year-old Jose Almeida, what would that conversation sound like, and what advice might you give him?
So me talking to like one of my sons or me talking to a young me,
A
which one?
young me, a young you.
At 20 years old. Um, Well, at 20, so what was I doing at 20? I'd probably tell myself, quit smoking weed every day and start getting your shit together uh, a little earlier. I don't know. I mean, I look back on my life and again, I've been fortunate. I'm glad I took the path that I did and the turns that I did and the moves that I made and the good ones and the bad ones I've learned. But, at the end of the day, knock on wood, I'm still healthy. I got a healthy wife and four great kids. That's really what matters most, health and family, as the old cliche goes. I believe in that truly. Good friends and I've lived well. So I don't know because I think destined to be a doctor, just living, and my father was a physician, uncles were physicians, we're all physicians. That's all I saw. I knew I was going to be a physician. When you're a kid and an adult comes up to you, what are you going to be when you grow up? And of course, I'm going to be a doctor. It's not even nothing else even entered my mind. There was no should I do this or should, and I'm going to be a doctor. That was obvious. And then when I saw my first operation, which is I was at Summer. I used to work in the emergency room locally when I come from Summer. And one day, a thoracic surgeon invited me to go up in front of my dad's and open the chest, and I saw the lung. I said, "Well, that's easy. I'm going to be a surgeon. That no brainer. That's done." And then I'm doing general surgery and clamp my first aortic aneurysm. Well, that's easy. That's done. I'm clearly doing vascular. So I think physician, it sounds corny, really is a calling. I don't think I had any choice in the matter. That's all that was coming in from the universe. You're going to be a doctor, and what came in from the inside, I want to be a good one. And as you, we worked hard at it.
Yeah, and I had similar background with my dad as a OBGYN and never really, you know, he used to say you could be anything in the world that you want to become as long as you're a doctor.
Yeah.
So, so here we are, Jose, many years later,
Yeah.
doing our best. And we close it out today, again, I want to thank you personally because you've touched my life more than you probably ever knew. And I'm sure there are many other people who feel the same way and kind of imprinting on you and looking up to you like a big brother from the programs way back when, and that's led to a lot of great things in my life, my career, and then how my kids are living now down in South Florida, and my interest in business and starting Vitasport MD and becoming involved in personal development and the books and all of those things that I think it's interesting for us to have this conversation because offline, everybody who's listening, we've never had this talk. Jose's hearing this for the first time, although we've known each other
Yeah.
for years, but it's made a big impact. And as a physician and as a person and as a man, you've touched a lot of people, and I congratulate you for that.
Yeah, well, thanks. Appreciate that. I didn't know a lot of that about you, but I appreciate the kind words. I'm glad you're doing well and you're happy.
It's a
Yeah.
pleasure. I like you. I've got a beautiful family, beautiful wife, and we've all been blessed. And um, I think when as we close out this episode of the Business of Better podcast, I think a couple of the takeaways are: do something that you love, stick with it. Don't expect an overnight success. Don't expect every project to be a winner. Not every project has to be based on financial gain for it to be a project that pays great dividends. Um, and as long as you're healthy and happy and you have a healthy, happy family and friends around you, then you're definitely winning. I think
Yeah.
that's a take home.
I think that's a good summary. Yeah.
Right. All right, Dr. Jose Almeida,
Hey.
Miami Beach, great vascular surgeon, educator, and friend. Thanks
Yeah.
for being with us today.
Well, thanks a lot, John. Appreciate it. Enjoyed being here.